Yes, Evelyn, I can see you are already online. Huh? If I have a sound problem, you tell me. Last week, the other week, the previous week, people are complaining of my sound. I'm trying to make it clear today. Today we are continuing with conventional medicine, and we are continuing with conventional medicine against contemporary medicine. You remember our topics? It's been a week we haven't met. Been a week we haven't met, so people have forgotten. Last week we talked about African prunus africanus. Today we will talk about something else. And you remember African prunus, what it gives us. You remember what it gives us. So if you have a question, you put it before the session ends. And the first link had a problem. That's why I've changed the link. Thanks, Evelyn. There are some people like Hilda from US. I think he is lost on communication because of the link. Let me share this link to the group so that people can know which link we are using. So today we are continuing with complementary medicine and conventional medicine. We talked about willow's bark, which produces aspirin. Foglove plant, remember, it produces digoxin for the heart. And then we went to chichon bark for quinine. Quinine is anti-malarial drug, but we have not covered that. We said we will cover it. Today we will talk about Artemisinin, annua. That's a tree that everyone has it around the compound. Mostly in Chinese tradition, it was used in Chinese traditional medicine, but currently is used as an anti-malarial drug under conventional medicine, not under complementary medicine. So we will see how you can treat yourself malaria as our grandfathers were doing it, but we will see also how in conventional medicine we can use it. We can use it as, just a minute. I want us to remind ourselves about the topics that we've covered. Now, the main topic of today, we are covering Artemisinin. Artemisinin annua is a drug that it produces artemisate or artemether, which treats malaria. But we will see in complementary medicine. Complementary medicine is the you remember the practices that our forefathers used to do, going to the forest and taking the leaves and using it. And you remember what we said? We said that what they help is the spirit. They help the spirit. They help the whole being of your body and the mind. I can see Jamaican uncle from the US. Yes, waving at me. That's right, uncle. I know people miss me. People miss me. Last week I had a very hard time coming online, but at least we managed it, and today we are here. I'm reminding ourselves what we were studying last week. The previous week, not last week. That is the previous week. The previous week we talked about so many things, and we talked about. Let me remind us that complementary medicine includes herbs and the practices that our forefathers used to do. But conventional medicine is the practices that we do in our normal hospitals, plus the drugs. So we started by the herbs, and we are going through, and we will lead to the practices. There is one practice that I shared, and someone from the Jamaica said, no, it was Jamaican uncle. Yes, he said that is the practice they do for kids, even right now, holding kids on their right side. And you see, we saw it was medical, even if it is still practice under cultural practice. They don't understand why it is medical, but it helps. Now we talked about let me go through the drugs we have talked about. You remember aloe vera, and we we saw the types. There are two types of aloe vera that can produce drugs, but the other ones we said there are just some are flowers and some are only laxatives. They don't have medicinal use. Remember the types of aloe vera that we discussed, and the most type of aloe vera that is medicinal is found under Asian grounds, African grounds, and some in South Africa. When we talk about aloe vera, now you know you don't just pick any aloe vera and you think you are helping yourself unless you have constipation and you want to relieve yourself. We saw about Ronfil Sapatina. Sapatina is something that helps in hypertension. We have not covered it, but we will cover it very soon. Today we will talk about Artemisinin. Turmeric, we talked about it. People use turmeric so much and they don't know how and what they are doing. But you saw everyone, yes, everyone who is in the chat, thanks for coming around. Now let's learn and let's increase the boundaries. Share this so that no one misses. It's a Monday and we want everyone to learn. Now, ephedra is a drug that produces ephedrine. Ephedrine is a drug that helps when you have flu, and when you have ephedrine is a drug when you have flu, you can use it. You can use it, and then your mucus airway. I'm just going through them, but I'll show you the pictures later. When you have problems in the mucus airway, it opens. When you have flu, ephedrine is like adrenaline. You remember, for people that has asthma and nasal decongestions, you use ephedrine. U3 cancer chemotherapy. When we are going to finish this topic, we are going to talk about cancer, and we will see which leaves that produces anti-cancers. And if you don't have the money to buy the anti-cancer, you can go on and use these tricks. There's someone who asked me at how is the dosage when it comes to complementary herbs. I told him you should ask a person who has experience. Me, I have experience with conventional medicine, and the only thing I'm prescribing is the components, not the trees. But you saw it's very important we study conventional medicine against complementary medicine so that we know. You remember we discussed that. Let's save time, but by not going there. We discussed about cannabis sativa. Cannabis sativa is you understand this one, cannabidiol, and we saw how it helps. The cannabis sativa, it is not, and we discussed why it is not legal. It is not legal, so don't say doctor said that. We can use cannabis sativa. Let's go to the topic of today, which is Artemisinin. Artemisia annua. Artemisia annua, a drug that is found from the Chinese, and it is the drug that is really used when it comes to the tropical countries. The tropical countries have a problem when it comes to malaria. Malaria is brought by a protozoa thing. You see, mosquitoes does not give you malaria. Mosquito is just a vessel to carry the protozoa to your body, and not all types of mosquitoes can give you malaria. There are some mosquitoes that can give you so many problems, like the Culex mosquito that can give you something called elephantiasis. Elephantiasis, have you ever come across someone who has elephantiasis? Complementary medicine and drugs produce Artemisinin annua. Yes, elephantiasis is a problem with your lymphatic system. Remember we said besides the drainage of the arteries, besides the drainage of the veins, we have the other one which is the what? We have the other one, which is the lymphatic system. So a person who has elephantiasis, if you have ever seen someone with elephantiasis, tell me. And as I find the picture of Artemisia, the main topic of the day. If you have the time, we will go through the other ones. Now, Artemisia annua from China. Is there anyone here from China? Anyone from China? Raise your hand. You want to know if you know this product, or you are a China who lives in the urban. You are Chinese who lives in the urban. You don't know anything about your plants. Now, I'm trying. Yes, this thing is even in Africa. Artemisia annua. It is even in Africa and even in the US. Let me show you this. This is what is called Artemisia annua. Let me show you this. Artemisia annua. Annua, a sweet name. Eh? It's like a name of a person. There's some people who are called annua. Now, let me check. I want to give you this. This is important. It's important you know what this is. This is the drug that we are having here. This minute, I'm giving you the image slide media. Image, yes. I want to give you the image of Artemisia annua. Artemisia annua. That one. That one is Artemisia annua. This is widely in Africa, everywhere. And you see, people don't know it. It is what produces mostly even in the western side of Kenya, where malaria is rampant, near the lake Victoria. For those who come from those regions, you know, near the Lake Victoria, you will find this thing called, when you dig, you want to cultivating your land, you remove it. Now, what you are seeing on the screen is called Artemisia annua. Artemisia annua. That is what is called Artemisia annua. Sweet wood. Sweet wood. Artemisia annua is also called the sweet wood. The sweet wood, but mostly it is found in the Chinese region. You see that? Look at that and appreciate. Let me post it here. Look at that and appreciate Artemisia annua, which produces Artemisinin lumefantrine. Artemisinin lumefantrine, used in malaria treatment. You see, that one is used in a minute. I want you to view. I think you've seen that one. Artemisia annua. Minutes. View the images and appreciate before we continue. That is what produces malaria. Malaria drugs. Minutes. Be patient. Yes, okay. Okay, you have seen the plant. That is the plant. It's loading so slow, but I see some people have already seen it. Do we have it here in Africa? Yes, uncle from Jamaica. It is here in Africa. This thing mostly grows at. It has a very sweet smell. In the western region and western region, I've seen it somewhere. It is there. So this one produces some compounds that have been used in the conventional medicine. You see how it looks like a flower, but it originated from the Asian community. They were using it as a drug of curing some issues, not only malaria, because we said for a drug to be known that it can cure, there were some people who paid the price, the elders and the four generation. They used it severally, but it came up to clear malaria parasites. So we went to the laboratory as conventional doctors, and we found out that this plant can treat malaria. Now let's go to Artemisia annua. Is a plant source of artemisinin, one of the most antimalarial discovery in modern medicine. It comes as you see when you get malaria, the first class medicine you will be given is what it's called Artemisinin lumefantrine. Artemisinin lumefantrine. So Artemisinin lumefantrine is antimalarial. Malaria is a parasite which is a protozoa. So the vector thing where is the mosquito, the Culex mosquito, it carries it in the proboscis, and when it bites you, it produces the the eggs, let me say the eggs, seeds to your bloodstream, and when they multiply, they start causing problems in your body. You know the cycle of malaria, how it goes. So this one, the main active compound in artemisinin and Artemisia annua is called artemisinin. Artemisinin. It is a lactone with unique endoperoxide bridge, rapidly kills Plasmodium parasite, especially the one that is found in Lake Victoria here in Africa called the Plasmodium falciparum. It is the deadliest mosquito current Plasmodium. It causes encephalopathy and it makes people become mad. You get it? So this one is the most bad thing that we have here in Kenya. Many women that are pregnant and they get malaria and they die, it's because of Plasmodium falciparum. But you see, artemisinin has been a breakthrough. Till now, it is being used as tablets or injections. So the modern drugs derived from this, the first one you have said is artesunate. Artesunate is the drug that we are using in our hospitals. But complementary, previously it was used as anti-fever, anti-malarial, and some other things that we will see. It has oral combination and it is used widely in Africa. And then we have something called artemether. That's why they are it's a combination of artemether lumefantrine. That means artemisate is water soluble. And then we find lumefantrine. We find the lumefantrine is just a minute. Yes. Mwambie angalie kitambo. Okay. Now we continue. We check on the artemether lumefantrine. Artemether is fat soluble. Sorry about that. It's water soluble. It's fat soluble. Sorry. Artemisate is water soluble. So it kills both. There are some products that are water soluble that if you give a drug that is fat soluble, it will not help. So it produces both, which are water soluble and fat soluble. You see, so it is a very big breakthrough in the modern medicine because it has both water soluble and fat soluble. Here we have dihydroartemisinin. Dihydroartemisinin from the same plant. We started by artemisate, we went to artemether, and now we have dihydroartemisinin. You see, now in dihydroartemisinin, the active metabolite of artemisinin drug is dihydro, often used in ACT combinations. Artemisinin-based combination therapies. When you are having malaria that is really disturbing and you want to have the combination of it, you use the ACT combination drugs. You see, just a minute, I paste this here, Okay, now this drug, it is mixed with other drugs. Now I'm talking about the conventional, not the other one, which is the complementary. And we said, when you hear me saying complementary medicine, you know it's the previous ones, that the herbs and the herbal practices that were used previously. But when you hear me talking about conventional, you know I'm talking about what? I'm talking about the current treatment regimes. So there are some antimalarials. When you visit Africa, most of you know what they do. You are given some drugs as prophylaxis. Some of you have always taken prophylaxis for malaria, and these are the drugs that have been found from the Artemisia annua, the plant itself. There is Artemisia lumefantrine, which comes as a name of cotton, first line in African countries, including Kenya, here where I am. So if you visit Kenya and you need a prophylactic management because you have never been here, you will be given coartem. Coartem is a combination of Artemisia and lumefantrine from the same plant. The second one is attenuate amodiquine. Attenuate amodiquine from the same plant. These are now components. This is not the herb. These are now components. And then we have dihydroartemisinin perpetuate. It is also a drug that is prophylactic. And then we have attenuate melphalan. I know there are some people who don't know what malaria is because their region never suffer from malaria. Why? Because the parasite plus the vector does not survive in that area. If you invite the vector in that area, it will die because of the temperature. They love living in low altitudes. Get it? In low altitude, not high altitudes. So if you go to a high altitude region and then you are diagnosed with falciparum, plasmodium falciparum, you will be asked if you have history of travel. But if you don't have history of travel, your blood should be taken to the laboratory to be done something called PCR to know why the vector survives in your body at high altitude. So you'll be a subject to research, you yourself, like the people who are subject to research on HIV that are resistant to CCR. We are about to talk about HIV and resistance to other cells, and we know why some people cannot get it. Some people cannot get HIV and some viral diseases. Now we go to the benefit and the uses of that plant is Artemisinin plant. You see the uses. Now you've seen it. Let me, for the people who are getting in, this is the plant that I'm talking about. That one is the plant that I'm talking about. Artemisinin annua. It's the plant that treats malaria. And if you take the juice from this, you will clear malaria, but it's a bitter plant. So the dosages when it comes to complementary medicine, as a doctor, I don't know. I only know the dosage when it comes to components, and we are in hospital. So if you want to know about the components, what do? We go and we search for the older people, the older generation that were here, and then we ask them what is the dosage, because with the time they deformed a dosage regime because of toxicity. You see, when you do some things, you know how to do them better. Now these are the other medical uses of Artemisinin as the plant, now not as the components like what I've said, like the Artemisia lumefantrine, Artemisate amodiquine. Those ones are used conventionally. There are some cancer research that are being done on Artemisinin. It has shown some tumor reduction. You know, tumor, when you talk about a tumor, we are talking about cells that have lived against their days, and now they are doing something that they are not programmed to do. There is something in your body called programmed cell death. So a cell should die so that the other one can come and live and do what it should do. So this Artemisate, it is under research of anti-tumor activity. So anti-tumor activity means to reduce the days and the programmed cell death to be active, selective toxins to other cancer cells. Some cancer cells. We have not talked about cancer. Cancer is coming, don't worry, we'll talk about cancer. But we had an overview last year, and we will talk to cancer as a whole, as a topic. That will be a very long topic. Let's talk about antiviral activities. The people that have hepatitis viruses A, B, C, D, and A. Now, this plant is under research. All these that I'm talking about, they are under research of antiviral researches. And also, we have another one called the SARS-like viruses. SARS-like viruses, everybody know about COVID-19. COVID-19 is a SARS like viruses. You get it? COVID-19 was a SARS, and some people used this plant and it helped them. So they are under research on how it can be helping in viral diseases. Someone is asking what SARS like viruses are. Those, a minute, let me show you. I'll show you what SARS like viruses are. SARS like viruses. SARS like viruses. SARS viruses, a virus is not like a bacteria because you cannot kill it. You can only suppress it by stopping some specific protein to grow or to produce. SARS-like viruses are a group of coronaviruses caused by related to virus that cause severe respiratory syndrome. So when I say SARS, I'm talking about severe acute respiratory syndrome. They belong mainly to beta coronaviruses. So when you have corona, you know you are having it, SARS-like viruses. You can go and pick the Artemisinin and use it because it has shown it can suppress the viruses, but it is under research. You can use it to suppress the viruses as a complementary, not as a conventional anti-inflammatory autoimmune potential. So we said anti-inflammatories are like paracetamol, aspirin, and brufen. Those are anti-inflammatory antipyretics. Pyretics is fever. Pyrexia is fever. So this plant has shown it can be anti-fever, anti-inflammatory. You get it? So when you have rheumatoid arthritis, you can use this as a complementary to the medicines that we give you, like prednisone, all those. Those ones, you can use it as those ones. So if you have any question about Artemisinin and annua, you drop it here. We see how we can help. You see, with the dosage, when it comes to complementary medicine, that one I cannot say. But when it comes to conventional medicine of dosage, I can give you a tenether lumefantrine, which goes to 8-hourly 4 tablets, and then you go for how long? For 7 days, or you get quinine for 7 days IV with a real dosage. But for complementary, that dosage I cannot tell you, because unless I get someone who was earlier in the days and how they were using it. Now we talk about something else, unless anyone has a question on that. We find another one, one drug. See, we have how many minutes? We have several minutes, around 30 minutes. Yes, we talk about a very important drug. I will repeat that one because everyone uses it daily. Everyone uses turmeric daily. Turmeric is called Curcuma longa. Curcuma longa, turmeric. If you cook your food, you use turmeric. Turmeric is always turmeric and yes, a minute. I'm trying to find it. You know, some people don't know the turmeric plant. They always see turmeric in the supermarkets. They always see turmeric in the supermarket. So let me find a turmeric plant. Let me see turmeric plant. When you see these pictures, it's good to appreciate, because one day you can be away from the pharmacies of conventional medicine, and then you you do what? They say save image as you don't have, or you don't have money to buy. So what do? And you have that plant there. You relieve the symptoms by what you have. So it's not good to not to know this. It's always good to know what you can use as okay. Let me bring the plant. Some people they have never seen the plant that produces turmeric. Turmeric is the legume, but the plant itself, they have never seen it. Now the plant is this one. Let me see where the plant is. This is the plant. What is coming on your screen, wherever you are, that is the plant. A plant that is anti-inflammatory. They use it when you have flus and you don't know how it is used. And that one is called turmeric plant. But the main thing that people use is, let me show you. Yeah. Let me show you the main thing that people use. Let me show you is this one. Minute. Let me show you. Come on, something so slow. Time is going. 7. That one, it's coming on your screen. Everyone, you will appreciate what you will see. You've seen the turmeric. No, this. You've seen that one. That one is the turmeric plant. I want to show you now what is used. What is used? Let's see what is used. Okay. Now that is what is used. What you are seeing is what is used on daily basis. And oh, Mercy is back. Mercy, the other link broke down, so we have got another one. You tell the other people who are lost. Now, what you are seeing is what people use in Africa a lot, and where I am, people use it a lot. It's called turmeric. Turmeric mostly is an anti-inflammatory. That's why when you have, we talked about the signs of inflammation: redness, hotness, and swelling. So when you have flu, what makes you not to breathe well is the inflammation, because of the redness, and you get it. So this is what they use, but they don't know how it works. It's widely used medicine spice in complementary and alternative medicine. When I'm saying complementary, you understand what I'm talking about. I'm talking about our forefathers, the complement system, the complementary, the forefathers system. Main active components in turmeric are called curcumin. Curcumin. Some people, you who you are watching me right now, you cook with it. You cook with this thing, and you never knew what the component in that thing helps. Now we have bright yellow preference that you see always in the turmeric, the legumes themselves. Those bright yellow preferons are called curcumin. These curcumins are anti-inflammatory. They make inflammation to reduce when you have flu, so that the airway can open up. When you have inflammation along your airway, your nose blocks. The sinus is a hole, but sinusitis is the inflammation around the airway that are the sinus. So when they swell up, they block. But if you take curcumin, which we get from the turmeric, what happens? It's an anti-inflammatory. It reduces the inflammation and your airway opens up. You see, it is also an antioxidant. Remember we talked about antioxidant. There is a difference between an antioxidant and what? And detoxing. Something that people always confuse a lot. If you are using an antioxidant, you are not detoxing. Detoxing is the work of the kidney and the liver. So if you go to a supermarket or anywhere in a facility of health, you find there something written as a detoxing agent, you tell them to throw it away because they are not doing the right thing. You see, you should use an antioxidant if you want to be healthy. Vitamins are antioxidants and they are never enough for your body. So if you've been confused, you as a medic, or who you are watching me, you are not a medic, with the products that are written on detoxing agents, you know what to do. Now, the other thing that curcumin does, which is turmeric that we have always everywhere, it's immunomodulatory. It modulates your immune system by bringing on some cells. If something can be an antioxidant, it helps some cells to come out and be active. That's why it regulates your immune system. Unlike artemisinin, curcumin is not conventional pharmaceutical drug. You see, we even have something that the conventional medicine has accepted as it is at the complementary level, and it is prescribed and told. It's just like this plant called, I remember I tell you, for pregnant women who are having hyperemesis gravidarum, they use it, and it's not a real drug. No, from the start, we were discussing about complementary against conventional, or in the right word, I'll say herbal medicine from before and practices against conventional medicine, drugs that are used in the modern society medicine and the practices. And we say complementary medicine is not just about the drugs, it is about the practice, just as the conventional medicine, which is not just the drugs, it is even the practices like surgery. You see, so when you talk about herbal drugs, don't just talk about herbs, talk also about the practices. You see, and that is where we are. We are started by herbs and we're going to practices. So what it is widely used in the conventional medicine, it is used in supplements, herbal formulation, and functional foods. You cook with it. Some people cook with this turmeric, and now you know it is an anti-inflammatory. I met someone who is HIV positive one day in my practice, and this person told me it reduces the viral load. So now you understand how it reduces the viral load. If your immune system is active at that part, we have the Mark 2 cells and Mark 2 and 3 at the complementary system of immune system. And then we have the killer cells. If they are active and you are HIV positive, they will reduce the natural killer cells kills the HIV direct. You understand? So this one, if you take turmeric and it's an immunoregulator, more natural killer cells plus the other 2 and 3 will kill the virus so faster. So you will be with a nil viral load. We will talk about this when we are talking about immunosuppression, not only in HIV. And I can see Doreen Small here. Doreen Small, hi, I see you. We are continuing with the topic of a previous week that we did not finish. Now, we complementary medicine uses. and specifically the turmeric itself. We have said it is a complementary medicine that is accepted as it is in the conventional medicine, not like the others which we derive the components. And these are the uses. Curcumin is commonly used for arthritis. Curcumin, especially osteoarthritis. Why? Because if it is an immunomodulatory, it works with something called the parathyroid to regulate the calcium that it can go to the bones and not systemic to the blood. So your bones becomes hard and you don't have osteoarthritis again. In rheumatoid arthritis, adjunct therapy. You understand what adjunct therapy is? When you are reducing inflammatory, because rheumatoid arthritis, the main problem is inflammation. If you have someone around you who is a patient, who is a family member or a friend, the main thing when this person have arthritis is pain. It's always pain. So if it is treated as an adjunct therapy, it helps this person to live comfortably without muscle soreness. You get it? So the mechanism is, there are some things that are called cytokines. Cytokines are mediators of immune system. Cytokines are things that mediate the immune system. Yes, they help the immune system to know what to do at what time, suppress what at what time, or increase which cell at what time. So these ones are COX-2. COX-2 mostly it is under your airway, from the lungs to your noses. And then we have NF-κB inflammatory pathway. It regulates it so that you cannot be sneezing around always. Always you are in public, you are talking to people as you are sneezing. No, it is a modulatory thing, but we are using it as it is. We don't derive any component. The only component that is in this legume is the curcumin. You get it? And then we go to gastrointestinal disorder like dyspepsia, yeah, irritable bowel syndrome, ulcerative colitis. When I'm talking about ulcerative colitis, you know, these are ulcers at the colon that are making you have constipation and food is not going well. You don't have the bacteria that digests the food for you to get vitamin B12. You get it? So it makes the acidity in the stomach to lower down, the pH to lower, so that you cannot have problems. If you increase the pH, you know what will happen. The pH level will not be okay. Thanks so much for those ones that are commenting there. I can see it's morning hours where you are. It's around 5 here in the PM. And if you have any question, drop it. We want to discuss those questions. I think people are appreciating. The only thing they have not seen is the curcumin, and those are coming here right now. You have not seen Artemisia annua, but let me put this again. I want you to see the turmeric itself. That one. You see the turmeric itself looks like a flower. Nice one. Very green and eye-catching. That one. Now we are continuing. We have seen about the gastrointestinal problem, how the turmeric. If you don't know what turmeric is, please say. We may be talking about something and people don't know, because this is a diverse platform and we come from every region of the world. So if you don't know it, tell us, we tell you what it is. But you have seen it, that one, what I've placed on screen, the picture, the green one with some good legumes that we are seeing, the curcumins, that is turmeric. We have said in the gastrointestinal problems, in before, even right now, you know, this is, now we are not talking about like the others, like we used to say that there is a component we derive from this plant. This is a very funny plant that even the conventional medicine, they have accepted it as it is, just like our forefathers used it. So it is being used right now as it is. You get it? We have not discussed a plant like this one. But now we are at the gastrointestinal disorders like dyspepsia. Dyspepsia, irritable bowel syndromes, ulcerative colitis at the colon. Hmm? It improves the gut barrier so that you cannot get acidity and pain when you have acidity. Reduces mucosal inflammation. If you have mucosal inflammation, the vilus of your gastrointestinal layer will not absorb nutrients so well, and you will feel pain. If pain is there, your mental status is at stake. Pain is a bad thing, but it's a good thing that shows us that you are still alive and you are responding to your nerves. You see? So both of them are good or bad. And then we continue and say in the liver, hepatoprotective. And every time I say about hepatitis is a disease, hepatoprotective is protection of the liver. So the liver, the sign HEPA. HEPA, you know we are talking about the liver, popular in herbal liver tonics like fatty liver disease. So the people who have fatty liver disease, you know what to do. Take some legumes of turmeric, the drink, cook with it, let it be like your bile juice to emulsify the fat at the liver, cells. Drug induced liver injury. You take a lot of acetaminophen. Acetaminophen, the paracetamol, it is highly toxic to liver cells. So as it is being metabolized from fat soluble to water soluble, it kills the liver cells. So what happens? You start having yellow eyes, yellow sores, bilirubin rushes to your eyes. So when you see this, before you get to the doctor to be given an antidote, you should be taking a glass of turmeric. You see why we are learning about the complementary system and the conventional system of modern life. It is life-saving. It is really life-saving, and we should say that our grandfathers and our forefathers were so nice that they introduced us to medicine before we started saying we are the doctor. You see, now at the liver it works at antioxidants at the liver, and reduces lipid peroxidation. Peroxidation is destruction. Peroxidation is destruction of the liver cells. Hilda Taylor. Hey, good morning. Yes, good morning, Hilda Taylor. I know Hilda Taylor is from Jamaica, and my song today was from Jamaica, Janine, about avocado as the antioxidant. I see you've made it here. The other link had a problem. Yes, Hilda Taylor. We continue. Now you know turmeric can help you in liver problems, being an antioxidant and having its effects in peroxidation. You see that? And then we go to metabolic conditions like diabetes type 2, dyslipidemia, and obesity. Yes, obesity, when you have a waist gut is around the waist, which is about 90 centimeters. You know you have insulin resistance. So if you have insulin resistance, what hits you? What hits you is diabetes, because you don't have enough insulin to do what? You don't have enough insulin to change the glucose you have in your system to glucagon so that it cannot go high. Or you don't have the glucose 1-phosphate 1 plus that takes the glucagon to glucose when you need it. You see, so type 2 diabetes, what do they do to these people when you give this person a glass of turmeric wine or turmeric soup? Improves insulin sensitivity to glucose so that glucose can take to cells and the muscles, and the excess goes to be stored in your liver as glucagon. You get it? Turmeric is a very good plant. We are saying it's a very good plant. So and it has got mild lowering of lipids. So as you take your atorvastatin, as you as a health worker, a doctor, a clinical officer, a doctor's assistant, a nurse, you are telling that patient to take what? Atorvastatin, statins. Tell this person be taking a glass of turmeric, so that it can be help you when it comes to insulin sensitivity and lowering and lowering what? And lowering your cholesterol. Very important. It is very important when it comes to cancer supportive care. But we've seen some things it helps when it comes to adjunct therapy. Adjunct therapy. If you have a question, our time is going. It's more than 30 minutes. I'm going to 1 hour. We should finish this today. If you have a question, drop it. Don't wait to finish, please, because we will be out of time. So, antiproliferative effect in the study of cancer. It has shown good antiproliferative effect. May reduce chemotherapy inflammation. When you go to chemotherapy as a cancer patient, and you have taken this, it reduces the inflammation. But this is under research. And then there is something so funny that our forefathers found out, that it is still under research, that topical or oral use may help when it comes to acne, psoriasis, or wound healing. Those three, very important: acne, psoriasis, or wound healing. So we are trying to find if the curcumin is the culprit behind helping. It is still under research, but when you have wounds, apply it. It can help. Yes, but don't ask me the dosage, because I've said we are trying to research and even balance between complementary and conventional medicine. There is common complementary formulations in nowadays. Turmeric capsules, they are there. Turmeric tea is there. You have seen it. Some people go I saw uncle one day in the US going for somewhere and I saw turmeric tea powder at the shelves. Curcumin extract, they are there. They can help you, but this one, the curcumin extracts are found in conventional medicine in the shelves of a normal pharmacy of a hospital. Enhanced absorption form, curcumin alone has poor bioavailability. So supplements also always often include black pepper extract. What I mean here is curcumin alone has poor bioavailability. It means when you take it, it is water soluble. It runs away from your body so fast. It gets digested and metabolized so fast within 2 minutes, 3 minutes. So what they do, they get it and they mix it. They blend it with something that is liposomal, something that it is absorbed by cholesterols. You get it? So if you take curcumin plus liposomal curcumin, what will happen is it will take a long time before it gets out of your body, before it goes to the liver to be converted to water soluble, so that it can go to the kidney to be removed. You see, it will take a long time. So they blend them. They blend the curcumin with pepper extract. Pepper is the normal pepper that we use as flavors in food, which is called pepperin. So they blend it. Those are blended drugs, so that it can help. So when you take a drug that you've not been having an allergic reaction, but one day you take one that you get an allergic reaction, just know what you have taken is a blended drug, just like this one, curcumin. Curcumin always is blended by curcumin. Now, integration to the normal medicine, turmeric integration to the normal medicine. It is used in Ayurveda. What is Ayurveda? I know some people know. These are traditional practices. Ayurveda is a traditional practice that was practiced in, let's see, we have not gone to practices. We are still at herbs. You see how complementary medicine is wide? It is very wide, and we should now get to understand the herbs. We get to understand the herbs. Now, in India, in ancient India, 3,000 years ago, there are these practices that they called life. Ayur is life. Veda is knowledge. So there are some practices that they were doing for life knowledge. Main classical Ayurveda books, we will see them. So when we go to integrated roles, when it comes to those turmeric, you will see they were used in Ayurveda. So as we finish the herbs and then we will go to the practices, you will find this turmeric in the practices. You see how herbs are connected to. Now Indians were using them in the practices of life knowledge. Life knowledge. So here we get Ayurvedic practice. It was used there. Maybe by steaming, we don't know. When we reach there, we will know. Traditional Chinese medicine and modern integrated clinics, often combined with ginger. We combine them with ginger. That is usually, everyone maybe does this. Boswellia and ashwagandha. Those are Indian trees. You see. Now we have discussed. Now time is getting out. If you have a question, please ask. My time is more. I have 3 minutes. You see how it is interesting. Today people are silently listening. No question. No questions, but I see you are getting it loud and clear. Loud and clear. So we have talked about two drugs that are artemisinin and this one, the one we are talking about, curcumin, the turmeric. Now, there are some things you need to know. Safe, generally safe, but possible issues may come out when you are not using them as conventional. When you are not using them as conventional, you may get these problems. These are the problems that you may get. Gastric irritation when you take high doses. Gallbladder contraction because it is getting mobile. You get it? And this one may end up you getting gallstones. And blood thinning. You remember some products have aspirin effects. Some chemotherapy agents may be got, and anticoagulants and antiplatelets. You get it? So the most evident level of complementary medicine against conventional medicine of turmeric is anti-inflammatory, osteoarthritis, metabolic syndrome. It is used in osteoarthritis, emerging evidence in cancer and neurodegenerative diseases. Imagine the normal turmeric that you know. It is used in cancer, osteoarthritis, anti-inflammatory effect. This is arthritis. So if there is no question today, tomorrow we will talk about some other plants. Before we go to practices, we will talk about ephedra, which is ephedrine, yew plant for cancer. We will talk for ephedrine and yew plant for cancer. Those are the two things. Cannabis sativa, we talked about it. So tomorrow be ready for ephedra and yew tree for cancer. You will see the plant and appreciate. So giving 1 minute for any question, 1 hour is hit, and my time is up. Anyone who has a question, as I steal this time for someone else? Anyone? Waiting for any question before I log out. That is how many seconds? 30 seconds. 30 seconds. If anyone has a question, please drop it. Drop your question. Drop your question. Drop your question. As I leave you with my favorite nutritional food song.